Good morning. My name is Corriveau. I'm the Director of Policy and Advocacy with Movember. I'm here with my colleague Todd, Minerson, who's the Country Director for Movember Canada. We're here because too many men are dying too young from largely preventable causes. There's a lot we can do. We just need the systems in place to be able to do it. We're calling on the government to invest in systemic changes through a national men's health strategy. Advocating for gender-responsive healthcare ensures everyone gets the care that they need. The Institute of Men's Health, which is a part of Movember, just released a Real Faces of Men's Health report to highlight this problem. This work was done in Australia and in the UK last year, and we're bringing it to Canada to demonstrate the unique challenge and opportunity that Canada has to really deal with the problem of premature mortality in men in Canada. We all have a brother, a father, a friend, a partner. This impacts everyone here. To give you a sense of the numbers, 2 out of 5 men in Canada, 44%, are dying before the age of 75, largely from preventable causes. This includes cancer, coronary heart disease, suicide, and many more causes. That equated to 75,000 men in Canada in 2023. Suicide is the 4th leading cause of death in men, 2nd for men ages 15 to 44. 3 out of 4 suicides are completed by men in Canada. And all these numbers are much worse for Indigenous men or men living in vulnerable communities. Poor men's health doesn't just impact men. It impacts families, communities, and the economy. In 2023, poor men's health cost Canadian taxpayers an estimated $12.4 billion. That's enough to fully fund the operations of 12 major hospitals in Canada for a year. Poor men's health also leads to loss of productivity, increased healthcare costs, and creates a greater strain on our social systems, all of which could be avoided through prevention, early detection, and better engagement in men in care. It also has a real impact on caregivers, many of which tend to be women. This hidden workforce experiences negative mental and physical and financial impacts. 66% of caregivers report having negative mental health outcomes, and 50% report having worse financial outcomes because of the caregiving. When men experience poor health, entire communities suffer. And this is happening because of stigma, gender biases, harmful masculinity norms, which all lead to a culture of silence and inaction. This prevents men from seeking care when they need it, and the delays lead to poorer health outcomes. To give you a sense of the numbers here, 65% of men will wait 6 days with symptoms before seeking care. And we're not talking about a common cold or a headache. 27% of Canadian men will wait over a month. Approximately 1 in 10 Canadians will delay care for over 2 years before seeking help. Men are less likely than women to engage in healthcare, in part because they struggle with health literacy. And it's not just them seeking care, it's also the healthcare system as a whole. First impressions matter a lot when it comes to men seeking care in a timely manner. A single interaction can be the difference between a routine checkup and a crisis. Only 48% of men say they feel actively listened during a first healthcare interaction. And if they don't feel listened to, and if they don't feel cared for, they might not show up again. So this is what the report shows, and we're hoping to have a first national open conversation about it. It can be a difficult one to have, but we're here with the numbers to show that this is something that we need to be doing as a country. And the good news is there's a solution. Canada has an opportunity, just like other countries have in the world, to address this challenge through systematic changes by developing a national men's health strategy that seeks to reach men, to respond to their needs and retain them in care. We hope to achieve this by strengthening men's health literacy, equipping healthcare workers with better tools to engage men, investing in and advancing research in men's health, and scaling gender-informed programs through a Canada-wide men's health centre with provincial hubs. So we're here in Ottawa to ask the government this: invest in a gender-responsive health policy and set of policies that recognize the unique needs of men. This will prevent thousands of unnecessary deaths, and it will improve outcomes for Canadian men, their families, their communities, and our economy. Thank you.
We don't have any questions at the moment. Sorry, if there's anything else you'd like to add.
No, we'll pass it to my colleague Todd Minerson for any additional comments.
Thanks, Catherine, for sharing the scale of the report. I would only add a few comments about Movember. We are coming up to our 20th year here in Canada. You probably know us as the men's health charity that has a lot of fun, growing mustaches and doing passionate, wild, and crazy things during the month of November. But we are also deeply committed to men's health. In those 20 years, we've invested through the support of our community over $112 million in prostate cancer research in this country, second only to the federal government's investment in that space. We just committed about $20 million to Indigenous men's health in Canada, and that also is proving to be a historic and transformative investment in Indigenous men's health. If you want to have a chance to go and look at the report and see what you can do, you can visit movember.ca and download the report. There's a heat map that looks at ridings across the country and how men's health outcomes are performing in those spaces, and some very useful tools to do your part in advocating for good men's health in Canada. Thank you.
Thank you. This concludes the press conference.